Hello, everyone. Welcome to another edition of our weekly webinars. Today's topic is low back pain. I myself am, my name is Curtis Bachoka. I'm one of the physical therapists that work here at Premier Physical Therapy. A little bit about our clinic. We've got two locations, one in Jacksonville Beach, one in Ponte Vedra. It is privately owned by a physical therapist. The best way I can describe it, it's a bit like a mom and pop shop. It's got sort of that local barber shop type of feel where there's a lot of meeting. It's a really friendly atmosphere. You really get to meet a lot of people and really low stress environment. Our subspecialties include orthopedics, TMJ and facial pain, lymphedema, running, and golf programs. So, low back pain definition, it's pain, muscle tension, or stiffness located below the ribs and above the inferior gluteal folds with or without sciatica. The inferior gluteal folds are basically your sit bones. Um, it is considered chronic after 12 weeks. This is very important information because chronic low back pain is a lot tougher to treat than acute low back pain. And the goal for us is to really prevent it from turning chronic. So, the incidence and prevalence of low back pain, 70% of people will experience low back pain during their lifespan. Most will resolve in 2 weeks. That's that acute low back pain that is very easy to fix. 20% will have persistent symptoms over 1 year, and 10% remain unable to work. No difference between men and women. So it could be very debilitating, and especially if you're out of work, it can be very costly. Little basic anatomy. So you got five vertebrae, L1, L2, L3, L4, L5. They're separated by round intervertebral discs. So the vertebrae themselves are made of bones. They're very hard, and the discs connect each of the bone and allow the bone to move. The best way to describe it is like it's like a bead necklace you would wear. The beads themselves very hard. They're like the vertebrae, and the strings that connect them are like the disc, except for the discs are a lot larger and they connect a lot more solidly on the beads. But they allow the beads to move in all sorts of directions. It can act as a shock absorber to cushion bones as they move and as you're standing and weight bearing. There's also ligaments around your bones that hold the vertebrae in place and aid in dictating movements. And also, there's a lot of attachments of muscles to these vertebrae to create movement. The nerves themselves come out of these holes here. When you get to about L1 or so, your spinal cord actually stops and it turns into nerves, just a string of nerves. Uh, and those leave certain holes called the foraminal openings, uh, which can go into your leg and your leg muscles and stimulate movements such as walking and lifting up your hip and squatting, using stairs, things like that. So, common sources of low back pain, you have non-specific, you have herniated discs, you have hip pain, sciatica and SI joint dysfunction that we're going to discuss today. So, non-specific low back pain, we have sciatica. So, the sciatica nerve is huge. It's almost the size of your spinal cord, which is almost the size of a small hose. Um, so if you have pain in the sciatica nerve from either stretching or injuring that nerve, you can have symptoms that radiate down your buttocks, down the leg, and can travel as far as the feet and toes. Sciatica symptoms may include the following in the leg. You can have pain, tingling, and numbness. Herniated disc is a little different than sciatica. It's when your disc actually, we call it herniates, and there's different levels, but you can see it bulging here in this picture, and it hits one of these nerves that are trying to supply your leg muscles. And then it can, so if you get a pinched nerve, it'll really affect your leg and your ability to walk. You'll probably be dragging your foot a lot, which is strange because it's actually stemming from the back. So here are the different types of herniated disc. So you have a protrusion or a bulge is disc and associated ligaments create an outpouching or a bulge. Extrusion, which is the outer layer of the disc, actually ruptures and the inner gelatinous part of the disc pushes out, which can cause a lot of inflammation and pain. And then sequestered, the center gelatinous portion of the disc is separated from the main part of the disc, and now it's floating around your spinal canal, which can be a huge problem, probably can affect multiple nerves and not just one nerve. Side joints dysfunction, excessive movements of the joints of the pelvis, the sacrum, and the ilium. So the ilium is the big pelvic bone. The sacrum is your tailbone, and between the two are your SI joints. As you can see, the big difference here between other joints is this line is the joint, so it's not very stable, versus the hip has actually a socket where it has a little more stability from the bones themselves. Here, not much stability. If there were no ligaments and no muscles, it would probably just slide off your skeleton. So it becomes a huge problem for women after childbirth because the ligaments are more lax and their pelvic floor might be a little weak or damaged. And so they lose both the muscle stability and the ligament stability, which can cause this joint to move too much. Hip pain. So the hip can also send pain into this region of the low back, um, to the groin, and it can present a lot like low back pain. So it's definitely something we want to include in low back pain treatment. So, say you had an MRI and it showed stenosis, herniated disc, degenerative disc disease, maybe a natural fusion of a couple joints. What do you do? This is a very big topic because a lot of people get MRIs and they're wondering if they should get an MRI before they even come to therapy. And we want to provide you the best recommendations to lead you to the most efficient path to recovery. So if you get an MRI, you're going to have a lot of findings on there. But recent evidence has from radiologists, they've done a lot of studies on MRIs in patients with low back pain and without low back pain. And you would have thought that the people with low back pain or history of low back pain would have a lot more findings, or at least different findings, than the patients without low back pain. But they found out that there wasn't much difference between patients with low back pain and without low back pain in these studies. So they MRI'd both of them. Some had nerve pain, some had back pain, some had no pain. There's really no difference between them. So what that means is if you get an MRI, no matter what, you have back pain, you don't have low back pain, odds are you're going to have findings on there. So if you're 80 years old, there's almost 100% chance you're going to have degenerative disc disease. If you're 20 years old, you still have a 37% chance of having it. So not worth treating it because odds are almost 50% of people at 20 years old are going to have degenerative disc disease. So nothing to worry about. It's almost considered normal. This bulging, 84% of 80-year-olds will have that. So it's more normal to have it than to not have it. Disc protrusion, little more rare, but still 43% of 80-year-olds have a disc protrusion. So what that's saying is you do not want to buy into MRIs too much, because even if you're not having pain, you can have a disc protrusion. And if you're in pain, you can have a disc protrusion. So not necessarily worth doing surgery on until we look further into it and get some more second opinions. Also, there's evidence that if you get an MRI too early, it can lead to more disability, because if you read these findings or you learn about these findings, you start to worry that you have a bulge, that you have degeneration in your discs. So you start to avoid using your back. You tend to rest your back more. You don't want to exercise as much. It leads to decreased activity and more disability. So MRIs should only be used in a few circumstances. One being if you're having advanced neurological symptoms, such as your leg is dragging more and more, you're losing bowel bladder ability to control your bowel bladder. That is something you want to get an MRI for. Or if you're suspecting red flags, or you're suspecting something like cancer or maybe a fracture, then you'll get imaging for that. All right, examples of muscle referral patterns. So muscles can refer down your leg or in different areas, and we could be chasing pain in some cases because they can refer in areas not where the muscle is located. This one is the most scariest, and not to scare anybody. It's actually not a scary treatment at all, but you can have trigger points in your glute minimus, and it can refer pain down your leg, almost resembling sciatica or a nerve impingement, because it can go all the way down to your calf. But this has a way better prognosis, because all you do in this case is work on getting rid of these trigger points with trigger point therapy, either dry needling, assisted tools, manual therapy, including cupping and soft tissue massage. Get rid of these trigger points, and then the symptoms will go away. Versus a nerve root is a little different. You can't massage a nerve root away. You have to handle that a little and manage it a little differently. The glute med, buttocks pain, tailbone pain, piriformis, right in the buttocks area. This will typically be the pain in the butt type of cramping feeling. It's probably a piriformis. Piriformis also can, we call it muscle guard. It can kind of cramp up when you're in pain to protect your low back. Multifidi, little bit in the tailbone there. This is relatively in the area where the multifidi muscle is located, so it's not too much chasing pain because they're located right along your spine. Quadratus can have low buttocks pain almost near the sit bone, and then you can have pain on the top of the pelvis or the iliac crest. Psoas gets a little tricky because it presents with pain in the front of your thigh and in your back. So it can resemble a high nerve problem in your back. When I'm saying high, I mean upper level, like an L1, L2 type of nerve problem. But in fact, it could just be your psoas muscle instead, and you'd work on these trigger points in these locations in the front of your back and the front of your pelvis and your hip. So, what can you do about your pain? You have a couple options, and decisions have to be made, and we want to help you make the best decision. So you sleep better at night. Not only sleep better because you're reduced in pain, but sleep better knowing that you made the best decision about your low back pain. So ignoring it might work sometimes. When you're young, you ignore pain and it goes away. But if it's not going away, 2 weeks, 3 weeks, you want to jump on it. You can alter it with medication, but typically you're only masking your pain and it can come back later in life because it's not cured. It's just getting masked for maybe a couple years and then it can come back because the root of the problem was never addressed. You're just curing the symptoms of the problem, but not what caused the low back pain in the first place. Or we can handle it. And in physical therapy, we want to try out what causes your low back pain. We look at it from, do you have muscle weakness? Do you have reduced hip range of motion? And now your back's trying to compensate and it's getting strained when you're going down to lift something. Um, and that's how we want to figure out what's causing your pain, not just massaging your back to reduce the pain, but figuring out what caused it in the first place and try to change that. All right. Ignoring it, like I said, it can pay off a little bit, but if it turns chronic, if you wait too long, if you wait 3 months, it might be almost impossible to fix at that point. It might be very challenging to get rid of chronic lower back pain. So, the way that back pain is usually managed is medication, bed rests, and imaging. And those, as we discussed a little bit earlier, is not really the most recommended for recovery. It's not the most efficient recovery, cost effective recovery, and long term prognosis is not the best investment for your back because it can increase pain. Your muscles can atrophy, which can lead to further disability and further pain. If you're working, workers who stopped exercising, who are afraid of movements, have longer periods of disability. Alter it. So, as we talked about earlier, well, actually, we haven't talked about it, but the research has shown that you can take some NSAIDs for your back, get some back exercises, maybe some mild muscle relaxants. Um, just temporary though. You want to get on a back exercise program as soon as possible. Likely to be beneficial. Fusion surgery. You don't want to get surgery because of pain. Surgery is going to be your last option. You want to get opinion, second opinion, third opinion. You want to try physical therapy, chiropractic treatment. You want to try any acupuncture. You want to try everything before fusion surgery because fusion surgery does not have a high success rate, probably only a 25% success rate, and it doesn't help with pain. You really want to use fusion surgery if you're having advanced radicular pain, loss of sensation in your leg, loss of strength in your leg, bowel and bladder control. That's going to be a really indication to get a fusion surgery. Um, but like I said, try these other conservative methods first, because once you get it, fusions aren't guaranteed to work. The only guarantee is you're going to change. Something's going to change, but we don't know if it's going to be better or worse. But most likely that's the only guarantee out of fusion. Unless, like we talked about, you have those advanced neurological symptoms, then it is a very good surgery. Um, So some treatments that have unknown effectiveness for chronic pain, things that aren't really guaranteed to work or to help are, local injections that could be hit or miss, epidurals, antidepressants. Lumbar support braces can actually weaken your muscles over time. TENS, very safe treatment versus medications and injections. And not many side effects, and it can relieve your pain. Traction, not much evidence for traction. Those things could be inversion tables you can have at home. Not much evidence in favor of traction as a treatment. What is included in physical therapy for low back pain? If you never had physical therapy before, it's tough to know what we do, what we offer that's different. Some clinics are different than others. So our clinic puts a lot of emphasis on hands-on care. This picture is showing some joint mobilizations, manipulations. We do soft tissue stretches, and what we want to do, like I said, we don't want to do anything without a reason. We want to find out why you have low back pain in the first place. So there's certain ranges of motion that you need to squat, to stand. We want to check your mobility, how well your vertebrae move, your range of motion of your hips. We want to investigate any trigger points that might be the cause of your pain. Once we figure out the cause of your pain, we do some hands-on therapy to either change a part of your body to make it move better or to relieve pain. And then we progress you through exercises and range of motion activities that are augmented because we do the hands-on therapy first, and it makes the exercises even more effective than they would be alone. So, and here's the research behind it: is manipulation with exercise was shown to be more effective than treating low back pain than exercise alone. So that augmented effect is huge, because you can do exercises at home, but sometimes you need that more augmented effect of the joint manipulation, mobilization, myofascial therapy, education on whether you have bad habits sitting at your desk, whether you're not walking or running with good form, whether you're not lifting with good form. So we want to give you tips on that. Sleeping. Um, People with chronic low back pain, you might want to focus on some other things to help your pain. Getting your recommended cardiovascular benefits, not only for your back pain, but for health in general, to reduce chances of getting cardiovascular disease, which is the number one killer in the United States. It reduces your risk of cancer too, which is the number two killer in the United States. So to get those benefits, to avoid uh, getting diseases or death, you want to do cardiovascular, moderate cardiovascular, 30 minutes a day, 5 days a week, or vigorous level cardio exercise, more intense like jogging, um, for 20 minutes, 3 times a week. Strength improves your function. You want to do strength exercises um, twice a week. Um, and you want to take a day off. You don't want to do strengthening twice in a row of the same muscle group. If you have pain over 3 days, if you're sore for over 3 days after your strengthening, you might have DOMS, or delayed onset muscle soreness. So to cure that, you might have to lower the weight and wait till it goes away. Um, but odds are the first time you work out, you'll get a little bit of this, but the second time you work out, it probably won't be there, probably won't be as noticeable. What happens when I exercise, or when you exercise, or when anyone exercises? You get when you exercise your muscles, you secrete an analgesic substance, which is a pain relief. It alters local immune cell function and increased anti-inflammatory effect. Helps with muscle relaxation, improves overall mobility, reduces depression and anxiety, which is actually a big chronic low back pain. If you have stress, depression, anxiety, it makes your low back pain more noticeable. example exercises for low back pain. We got classic bird dogs here. Great exercise for your whole body, everything. Swimmers, really good for your back. You have core muscles in the back of your spine, the front of your spine, and the side of your spine. This one works the side of your spine. This one also works your glutes and the side of the spine. This one works the back of your spine and the glutes. Patient sitting at your computer. Avoid sitting on your tailbone. You want to maybe sit on the little glute muscles, and your back can flex and rotate and twist. But on the floor, if they're not reaching the floor, you can be having a lot of curve on your head, a good height. Keyboard above belly button height, and no reaching for items. You can twist and pull your back with reaching. Proper sleeping position. If you sleep on your side, head in neutral position, which is not tilting one way or the other. Pillow between your knees, your legs. And if you sleep on your back, you want your head slightly elevated with a support pillow. And then putting a pillow under your knees can help keep your back in a nice normal alignment. Don't sleep on your stomach. That is not recommended. Nutrition, always an important factor, especially anti-inflammatories. And I'm not a nutritionist, but you can look up anti-inflammatory foods online, such as fish oil, turmeric, things like that. And like I said, look it up online first to really get the best information, or getting a book about it. Sleeping, you want to sleep 8 hours a night. Not everybody fits this model, but sleeping really can allow your body to heal, boost your immune system. Smoking is not good. It reduces your blood flow, and blood flow allows you to heal. So, physical therapy options: come into the clinic for an evaluation. That's why we can figure out the cause of your back pain, not just masking your back pain. If you're not comfortable with coming into the clinic, you can schedule a consultation with a telehealth visit. It may depend on your insurance, so please call the clinic to get your insurance benefits run. Start with education and exercises described, and come in when medically able. So you can try these exercises, try any exercises, try the sleeping advice, try the exercise advice. If you still have back pain, we would definitely recommend, if it was my back, I would want to go to a therapist for an opinion for getting imaging, before getting any kind of imaging, before getting injections, um, because therapy is all natural, no side effects, and we could really find the solution to what is causing your back pain in the first place, and not just masking your symptoms. So if you have any questions, please post them in the comments below. We will post this to YouTube in the future, so you can watch it anytime you want. Our phone number, 904-996-6922. It's Friday. It's almost the weekend for me. So that is it for today's webinar, and have a good day.